Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is the difference between Herceptin and Herceptin Hylecta? Herceptin contains one active ingredient, Trastuzumab, and is given as an intravenous, infusion slowly into a vein. Herceptin Hylecta contains two active ingredients, Trastuzumab and hyaluronidaseoysk, and is given as a subcutaneous injection, which is an injection that goes under the skin. Herceptin and Herceptin Hylecta are not interchangeable. Table of differences between Herceptin injection and Herceptin Hylecta. Herceptin injection. Herceptin Hylecta. Active ingredients. Trastuzumab. Trastuzumab and hyaluronidaseoysk. Treatment. Adjuvant breast cancer. Metastatic breast cancer. Metastatic gastric cancer. Adjuvant breast cancer. Metastatic breast cancer. Are they interchangeable? No. No. Form. Single-use vial powder to be reconstituted with sterile water for injection. Multiple-use vial powder to be reconstituted with bacteriostatic water for injection. Single-use, ready-to-use solution for injection. Administration route. Intravenous infusion equals slow 4 into vein. Subcutaneous injection equals injected under skin. Time for administration. 90 minutes for initial dose, which can be reduced to 30 minutes for later doses. Given over 2 to 5 minutes. Administered by healthcare professional. Healthcare professional. Storage. Single-use vial. Before reconstitution, store in the refrigerator 2C to 8C, 36F to 46F. Once reconstituted, if not used immediately, must be stored between 2C to 8C, 36F to 46F, and discarded after 24 hours if not used. Multiple-use vial. Before reconstitution, store in the refrigerator 2C to 8C, 36F to 46F. Once reconstituted, solution can be stored between 2C to 8C, 36F to 46F, for up to 28 days, after which remaining solution should be destroyed. Stored in the refrigerator at 2C to 8C, 36F to 46F, until just before use. When it can be at room temperature, 20C to 25C, for up to 4 hours. Treatment is only indicated in these conditions for selected patients, who have a specific type of cancer, who will be using specific treatment regimens, and patient selection can be dependent on previously used treatment options. Related questions: what are monoclonal antibodies? What are biosimilar drugs and how do they compare to biologics? How long can you stay on Herceptin and Perjeta? Indications. Herceptin injection is indicated for use in specific patients with adjuvant breast cancer, metastatic breast cancer and metastatic gastric cancer. Herceptin Hylecta is indicated for use in specific patients with adjuvant breast cancer and metastatic breast cancer but not metastatic gastric cancer. Length of time for administration. Herceptin injection is given as a slow 4 infusion over 90 minutes for the first dose, which can be reduced for late doses down to 30 minutes. Herceptin Hylecta is given as a subcutaneous injection under the skin over 2 to 5 minutes. Storage. Both Herceptin and Herceptin Hylecta need to be stored in the refrigerator at 2C to 8C, 36F to 46F, until required, but have different storage requirements after this. Once the Herceptin injection single-use vial is taken out of the refrigerator and reconstituted with sterile water for injection, it should be used immediately or must be stored in the refrigerator and then discarded after 24 hours if not used. Once the Herceptin injection multiple-use vial is taken out of the refrigerator and reconstituted bacteriostatic water for injection, it can be stored in the refrigerator between at 2C to 8C, 36F to 46F, for up to 28 days, after which remaining solution should be destroyed. Herceptin Hylecta is stored in the refrigerator until just before use, when it be at room temperature, 20C to 25C, for up to 4 hours. After this time, if it has not been used, it should be destroyed. RxCardClub.com Get a free prescription drug card and save up to 80% on prescription drugs.